Thank you very much. First of all, I want to say it's a great honor and a privilege for me to be given the chance to this the ASCO honorable plenary session. My name is Takayuki Yoshino, a medical oncologist basis, National Cancer Center Hospital East in Japan. I already introduced my presentation that talking about the panitumor versus BEV in combination with the standard chemo modified FOXO6 patient in the first-line setting and patient with RAS-wild type metastatic colorectal cancer. So, background information that the colorectal cancer is the third common diagnosed cancer worldwide, and estimate 2 million new case diagnosis 2020. So, about the 36% of the colorectal cancer patient had metastatic disease at diagnosis. So, addition of the anti-EGFR or the anti-VEGFR monoclonal antibody to standard chemotherapy improve overall survival of patients with metastatic colorectal cancer up to median overall survival of the 30 months. So, cumulative retrospective evidence suggests that longer overall survival with the anti-EGFR antibody over anti-VEGF antibody, bevacizumab, in patients with RAS-wild type and the primary tumor, left-sided tumor, defined as a descending colon, sigmoid colon, rectosigmoid, and the rectum. So approximately 35% of the metastatic colorectal cancer. Nevertheless, both anti-EGFR, VEGFR antibody are used in patients with RAS-wild type, left-sided tumor, which warrants prospective comparison in this refined population. Now, please keep in mind, US in the United States, both anti-EGFR, VEGFR was used. So, Paradigm is the first prospective study to test the superiority of panitumumab versus over bevacizumab plus standard chemo for patients with RAS-wild type patient. So, this is the trial scheme. You can see patients with RAS-wild type patient, RAS-wild type metastatic colorectal cancer were randomized in a 1-to-1 ratio, comparing panitumumab versus BEV in combination with the same modified FOXO6 until disease progression, patient withdrawal, intolerant, toxicity, and the curative resection. The primary endpoint is that left-sided population OS. If the significant hierarchical way, we analyze, moving forward to analyze OS in the overall population defined as both left-sided and right-sided population. So here is the most important slide in my presentation, left-sided particularly. You can see OS in the left-sided population, you can see with a hazard ratio 0.82, p-value 0.031. If the p-value 0.04202 less than, so we will consider as significant. So we move forward to the second primary endpoint analysis, OS, in the overall population. You can see similar message brought forward in this patient population. Looking at the median left-sided once again, you can see more than 3 years overall survival in panitumumab plus modified FOXO6, 37.9 months. It's never reported previously. So, in conclusion, in this presentation, that phase 3 paradigm study met primary endpoint 1 and 2 both, that demonstrated the superiority of the panitumumab over bevacizumab in combination with the modified FOXO6 in both left-sided overall population both. You can see here the median value overall survival, the 37.2 months favoring panitumumab in left-sided population. 36.2 months in overall population, so proceeded more than 3 years in both populations. So panitumumab and the modified FOXO6 demonstrated longer survival ever reported in the first-line metastatic colorectal cancer phase 3 setting. So in conclusion, in this presentation, these results established standard first-line combination regimen for patients with RAS-wild type left-sided metastatic colorectal cancer. So currently the multi-omics analysis ongoing, some data already finished. You can see here, note, 92% of the plasma tissue pre-treatment already collected and analyzed. Now you can see here right at the bottom, as post-treatment, you can see here 76% of the plasma also be collected, and also 161, which is a number, old number, who conducted the convergent surgery at the curative intent already collected. These are analysis shown here, middle, white box. You can see tissue plasma DNA sequencing, of course, the RNA sequencing, signature analysis, multiple immunofluorescence analysis with artificial intelligence. These results also be available in the future upcoming international meeting. So thank you very much for kind attention.